So a fever is considered a body temperature of 100.4 or higher. A fever is simply your body's response to infection and your brain's way of fighting infection in your body. So fever in and of itself, it should not be something that we fear, but we just treat appropriately. There are many causes of fever, from viral infection to bacterial infection, and the height of the fever doesn't necessarily tell you whether or not it's viral or bacterial, and so that's where your pediatrician comes into play. Always being sure to contact your pediatrician if you think your child is ill. So a fever is considered an emergency in any child less than 3 months of age. Those children need to seek more immediate medical attention because the chances of it being something more serious, like a bacterial infection, is higher. After 3 months of age, certainly and under 2 years of age, a parent should contact the pediatrician for any child with fever under 2 years of age within 24 hours. After 2 years of age, typically it is okay to allow a child to run a fever for up to 48 hours before contacting your pediatrician. The exception to that would be if your child has concerning signs, lethargy, marked decrease in activity, certainly seizures, stiff neck, if they've been exposed to a situation where they might be overheated, such as a hot car. Those are reasons to seek more immediate medical attention. Or if as a parent you just have a concern, something's not right with my child, I think it's always good to pick up the phone and call the pediatrician. Any child under 3 months of age having a fever of 100.4 rectally or higher does need to seek immediate medical attention. And especially a fever that you can't bring down with appropriate doses of anti-fever medications. It's important to remember that when a child has a fever, they can get dehydrated more easily, losing fluid through their body from the fever itself. And so keeping a child hydrated with fluids is very important during a fever. You can also use fever-reducing medications such as Tylenol or Motrin. Tylenol can be given at any age, but Motrin should only be given to those ages 6 months and older. Dosing of the fever medication is very important because overdosing can be detrimental for a child, as can underdosing. And so it's very important that you contact your pediatrician about appropriate doses of Tylenol and Motrin for your child. Other ways to treat fever besides careful attention to hydration and fever-reducing medications would be something like a lukewarm bath. It's going to feel slightly warm to the parent but cool to the child. Also dressing in light clothing and letting the child rest. When a child is ill, it's best not to try to run a lot of errands and have the child in a lot of activities. They need to stay home and rest. Fever is common. It's something that parents should not fear. Your pediatrician is here to kind of guide you through it, and I think whenever a parent has a concern about a child with fever, it's always best to pick up the phone. And if you're very concerned about a very ill-appearing child, seeking immediate medical attention in an emergency room is always the way to go. I think you have to trust your instinct as a parent. Pediatricians at the Baton Rouge Clinic want to be available for children with fever, and to do that we have after hours. We have hours Monday through Thursday from 5 to 7 p.m. to see sick children. We also have hours on Saturday and Sunday mornings for our sick children. So we certainly want to be available for our patients in addition to our normal Monday through Friday hours.